Pasok.
Hello po, sir. Good morning po. So, I am Sophia Berhel. I'm a student nurse from Muslim University, Philippines. And I will take care of you from 1 p.m. until 4 p.m. So, for safety purposes po, would like for you to state your name po, your age, tsaka birthday po. Pangalan niyo po?
Iwan Calix Ibrahim V. Valdez po.
Yung birth date niyo po.
July 8, 2009 po.
Ilang taon na po kayo, sir?
12 years old po.
Okay po. So, thank you po, sir. So, for today po, we'll be doing a procedure called po na, tinatawag po na complete bed pad po. Kung saan po, lilinisin po natin lahat ng buong katawan nyo po, using po yung wet towel po. And then, we're gonna do shampooing rin po, kung saan hugasan po natin ang yung mga buhok po. And then, mag-start po tayo sa shampooing. Diretso po tayo sa inyong eye care, nose care, oral care, and then sumunod po din ang iyong body or your extremities po. Sumunod po ang iyong foot, lastly po is yung back niyo po. So for me po to continue with this procedure po, I would like to ask for your cooperation. Would that be okay with you po?
Opo.
Okay. Thank you po, sir.
Nay, ano mo ba? Kasi may tuwal na.
Tuwalya, hindi tuwalya lang.
Nay, kamakit yung ganda nagpong preso kami dito.
Ay, mo ang magkala ko. Sabi mo,
Gather the necessary equipments that we'll be needing. Now I'm gonna perform the hand hygiene. So after we do the perform the hand hygiene, now I'm gonna put the gloves. To prevent any transmission of the microorganisms to the patient. After that, we're gonna inspect the patient's scalp and head to look for any signs of any abrasions, inflammations, lacerations, and infestations. Sa side tayo, sir. Demonstrate po tayo. So, if we see any signs of any infestation, we're gonna use a special treatment such as a shampoo for the dandruff, for the lice, and a hydrogen peroxide for the blood clotting of the patient's head. Now we're going to position the patient in a supine position. Now we're gonna put a rolled towel under his neck to support his neck and his head. And also put a basin under his head. Sir? Okay, so po ba tayo, sir? Okay. Now after we put the basin under his head, we're gonna put a towel over his chest. Now we're gonna use a comb to untangle his hair. Now we're gonna put the towel over his eyes. Now we're gonna start. Now after we fill the basin of a 2/3 of warm water, we're now gonna use it to wet his hair little by little. Now we're gonna use a shampoo. Starting from his hairline. Over his head. Now under his nape. Now we're gonna rinse his hair until there are no present of shampoo. Now, we're gonna get rid of the basin and use the towel under his neck to wipe it, to dry his hair. So after we get rid of the basin, now we have to pat dry his head fully using the towel underneath his head. Now after we fully dry it, we're gonna use the comb to untangle his hair. So sir, do you prefer po bang gumamit pa po ng conditioner?
No.
Okay po. Now get rid the towel and dispose all the supplies that we have used. And we're gonna put it on the hamper or the laundry basket. After that, we're gonna position the patient in a comfortable position. So after we done the shampooing and the pat and also comb his hair, now we're gonna get rid of the plain gloves. I mean the soiled gloves, and perform hand hygiene. After that, we're gonna document all the findings or the abnormal findings that we have seen on the client record. Now we're gonna proceed with the nose care. In here, we're gonna help the patient in a semi-fowler's position. Sir, pasok po kayo. Isip po tayo ng konti dito sa bandang taas po. Sige lang po. Gusto ko dito kayo dito, sir. Sige lang po, sir. Sige pa po. Ayan po. Now we're gonna apply clean gloves to avoid the touching of the mucus. Now we're gonna give him a soft tissue. I'm gonna ask the patient to softly or gently blow some secretions of his nose. Sige po, sir. Sige po. Sige po. Now we're gonna dispose the tissue that we have used. After that, we're gonna use a cotton tip, like here, and we're gonna moisten it with a water. Now we're gonna put the moistened cotton tip on his nose. Hindi po natin isasagad yung cotton tip kung hanggang sa lang po makikita po ito to avoid po yung pagsapat po yung kanyang nose. Use another one po for the other side. Now we're gonna dispose all the supplies that we have used. And now I'm gonna get rid also of my gloves and perform hand hygiene.
Good morning, sir. Now we're gonna do your oral care. Now I'm gonna prepare the necessary equipments and supplies that we're gonna be needing. So after I have done the hand hygiene, now I'm gonna put some gloves to reduce the transmission of the microorganisms. Now I'm gonna position the patient to check his gag reflex. Now I'm gonna get the tongue blade to check his gag reflex. And also the pen light. As I check his gag reflex, he able to do it, which is now I'm gonna position the patient in the sideline position. Now I'm gonna put the bath towel onto his side. Also the basin for the excessive saliva that will be coming out to his mouth, and also the unnecessary water, and also I put the pillow for support. Now I'm gonna get his toothbrush and moisten it with water, and also put some toothpaste. Now I'm gonna start brushing his teeth by asking him to open his mouth because the patient is still conscious. So I begin brushing his teeth in the inner surface and this the chewing teeth. Then I proceed with the his outer surface teeth. And I ask the patient to spit out for the unnecessary or the saliva to come out. And now I'll be rinsing his toothbrush with water. And here I'm going to brush his teeth to rinse out the um, left out toothpaste. Again, I ask the patient to spit out the leftover salivas. Now I'll be using a towel to pat dry his mouth to remove the saliva or anything in water to his mouth. Now I'm gonna put a lip balm to moisten his lips. Now I'm gonna move out the bath towel and the supporting pillow. Now I'm gonna remove my gloves and dispose of it. And now I'm gonna proceed with moving the patient in a comfortable position. Now I'm gonna perform hand hygiene, also wash or disinfect the basin that I have used. Now I'll document all the findings to the client record. So, thank you for your cooperation, sir. This is the end for your oral care.
Next that we will be doing is the eye care. And here, we're gonna assess the patient if he'll be able to tolerate the passing. And we're gonna determine if what level of bathing that we are gonna use. Okay. So the patient can be able to tolerate the complete bed bathing, which is good. So after we assess the patient's tolerate for bathing, we're gonna explain the procedure to him. So sir, in here po, we're gonna perform the complete bed bathing po, kung saan po mag-start po tayo sa inyong mata, eye care po, and then to your face, and then to your arms po, your legs and foot, and lastly is your back po, okay po? Okay po. Now after that, we're gonna gather the necessary equipments or supplies that we are needing. So after we prepared the necessary equipment, I also adjusted the room temperature and ventilation for the patient to avoid chilling during bathing. Next, what we are gonna do is close the rooms or the doors for the patient's privacy. Sir, do you want po ba ng urinal?
No.
Sige po, sir. Offering a bedpan or urinal will avoid the interruption during the bathing if the patients want to void. Now, after I perform the hand hygiene, now I'm gonna apply clean gloves to avoid transmission of the microorganisms to the patient's any lacerations or abrasions or to his skin. Now what we're gonna do here is we're gonna position the patient in a comfortable supine position. Baba po tayo ng konti, sir. So after we put the patient in the supine position, we're gonna bring him close to me for me to be comfortable or in a working comfortable position. Nice na po. Now we're gonna place a bath blanket to the top of the linen. And after that, we're gonna remove the linen. Oh, maybe, sir. outside linen will be put on the laundry basket. And now I'm gonna remove the patient's gown. So if the patient has a IV line onto his arms, we're gonna first remove the patient gown on the unaffected area. But due to patients have no IV line, we're gonna proceed with any each side of arms. So after we get rid of the patient gown, we're gonna fetch some water on a basin, which will be filled by 2/3 of warm water. So now after I fetch some water, I'm gonna ask and also gather the supplies that I needed. I'm gonna ask the patient regarding the temperature of the water by placing his fingertips on the water. Sir, kanya pa ulitin mo. Malamig po ba or tama lang po?
Tama lang po.
Okay po. Now after that, we're gonna place a bath towel under his head and also over his chest. Now we're gonna use a cotton pad or cotton balls for the patient's eyes. And I'm gonna soak it with water. Okay po tayo, sir. We're gonna start with the inner canthus to outer canthus. We're gonna get rid the cotton that we have used, and we're gonna get another one. Inner to outer canthus. Try using the towel. Now we're gonna proceed by using a washcloth and soak it with water and drain it thoroughly to avoid the excessive water. And we're gonna do it in a meat fashion. And we're gonna start by the putting the meat. We're cleansing his face, starting with the forehead, down to his cheeks, and down to his chin. After that, we're gonna proceed with his ears. Other side. And we're gonna rinse it with water again. we're just gonna repeat the same procedure. And down to his neck. Now we're gonna use the towels to pat dry his ears and necks and his wrist. Now we're gonna use the blanket and put it over here, the farthest arm. We'll proceed first with his farthest arm and put it under here. I'm gonna start here, finish this style. His arms up to his axilla, from his hand to axilla. We're gonna do a firm long strokes to allow the blood circulation good properly. Now, sir, can you put your ano po? Your hands. Ito po. Pili-pili mo. Now, we'll cleanse his arms to his axilla. Pat down. Tapos ulit natin sila. So due to the patient's age, he doesn't use deodorant for meantime. So we're not gonna put a deodorant. So now we're gonna put a basin with water and let his hands soak for 2 to 3 minutes. After 2 to 3 minutes, we're gonna pat dry his hands. Now we're gonna proceed to the other arm. We're gonna do it the same thing that we have done to the other arm. Then, as I said, we're gonna Go first to the distal to proximal. To allow the good blood circulation, you have to do the long pyramid strokes from distal to proximal. Now we're gonna pat dry by using the towel. Circles po. Pwede ka rin use towel. Pat dry, isak sila. Now then we're gonna put a basin full of water. Warm water and soak his hands for about 2 to 3 minutes again. Walang biyak. After that, we're gonna place the towel over his chest. We're gonna put the bath blanket under his umbilicus. We're gonna use so I have used another set of water which is also warm. And also the washcloth. Also I'm gonna do it in a neat fashion. Now I'm gonna cleanse his chest. Now we're gonna pat dry. After that, I'm gonna cover him with the blanket. Get rid of the towel. So after we cover the patient's chest and abdomen with the bath blanket, also his foot up to his thighs. Now we're gonna expose his hardest leg and make sure that the perineum is covered also. Now I'll be using another set or batch of a water. Now I'm gonna place a bath towel under his legs. Now I'm gonna wash his legs using the washcloth in a mitten fashion. And use it in a from distal to proximal, from his ankle to his knees. And from his knees to legs. Now I'm gonna dry it with the bath towel under his legs. Now we're gonna proceed by placing the basin to under his foot, and also we're gonna support it with the bath blanket. Bath towel to avoid the spilling of water. We're gonna let the his feet soak on the water and use the soap. And we're gonna use the soap. Now rinse it. So after that, we're gonna remove the basin and pat dry the feet with the bath towel. Now I'm getting rid of the bath towel and cover his legs. Then now we're gonna do it on the nearest leg, the nearest side. Now I'm gonna put again the bath towel under his legs. Now then we're gonna use the towel in a neat fashion. And use a long firm stroke from his ankle, foot to ankle, ankle to legs, and his knee to thigh. After that, we're gonna use the bath towel to pat dry the legs. Now again, I'm gonna use the water basin with the water. Now again, I'm gonna use the water with the basin. I'm gonna soak his foot. For about a minute. Then I'm gonna use the soap. And use the washcloth to wash and clean the foot. You have to make sure that the spaces between the fingers of his foot, I mean his toe, must be cleaned properly. After that, we're gonna get rid of the basin and pat dry the foot. So that we're gonna cover his legs. And now we're gonna proceed with his back. Now we're gonna proceed with his back. We're gonna position the patient in a side lying position. Dito tayo sa sila. Dito. Right. Now we're gonna expose his back. So we're gonna use another set of water. We're gonna put blanket under. Now after that, we're gonna wash and rinse. Deposit from his neck, his back, from his buttocks. Now we're gonna dry using the bath towel. Do that. Take a riser. Now we're going to proceed with his anus and buttocks area. So because if there's any signs of any fecal matter, we're going to use a tissue or wet wipes to remove the fecal matter. Now we're going to dispose of it. After that, we're going to wash it again with the washcloth to ensure the cleanliness of the area. Now I'm going to use the blanket for dry. So after that, we're going to dispose of all the supplies that we have used. Now I'm going to return his position in a spine position. Okay, that's it. Thank you, sir. So after that, we're gonna document. So after I done with it, I have performed the hand hygiene. And next is we're gonna next is that we're gonna document all the necessary findings in the client record. And also we're gonna record the amount of the assistance provided by the patient's participation in care also the condition of skin, and any significant findings such as skin irritations or reddened skin, and etc. After the complete bed bath, we're gonna rest the patient in the patient ground. And dispose it into the hamper or the laundry basket. So after that, we're gonna document all the findings that we have found, such as the abnormal findings, like the redness or the swelling or any skin irritation. Also, so sir, thank you for your cooperation. And now it's done po.